right, so I've marked out the places I'm going to put Botox. So make a frown. This is the glabella, and I've marked out the edges of the glabella and everything. That's going to take away these 11 lines. Now raise up, and I've marked out the area on the frontalis muscle. I'm going to avoid the frontalis muscle out here so that when she tries to activate it, it'll only make the lateral brow come up and not anything in here. So it'll give a little chemical brow lift. So I usually do about 15 to 20 units of Botox into the glabella. And then I do about 10 or so units up into the frontalis muscle. Jody's got a little bit of a short forehead, so, and she doesn't have a very strong frontalis, so I need less in that part. So I'll take a couple of units and I'll put it in the upper tail of her orbicularis muscle at the lateral tail of her brow, and that is a depressor muscle. So when you paralyze a depressor muscle, what it'll do is it'll elevate it. So we'll get a little elevation of the brow. So not only will, by avoiding Botox out here, this muscle is still going to function to lift the brow, and then I put Botox here to take away the depressor function of orbicularis there. So those two things in combination give you a little chemical brow lift. So that's going to take a few days to see the effects of it, because Botox takes a few days to start working, and I say full effect by 2 weeks. Botox is a neuromodulator, which means it relaxes wrinkles. We use it in the forehead and around the eyes, which will prevent wrinkling in these areas and keep your upper face young. Filler, on the other hand, is used to put volume back in the face and sometimes fill wrinkles from below. Examples of this filler are Juvederm, Restylane, and Versa, and these things can be used in different ways depending on what your needs are as an individual.